7 medications sitting in your pill organizer right now could be quietly draining one of the most important vitamins your brain and nerves depend on. And mistake number 4 is so common, there's a good chance you're taking it this very morning. Here's what almost nobody tells you: the fatigue you've been blaming on just getting older, the tingling in your feet you've written off as bad circulation, the memory slips you've been quietly worried about. All three of those can trace back to one thing: a vitamin deficiency that builds so slowly you don't notice it happening until it's already affecting your daily life. And the medications behind it aren't some obscure prescription. They're some of the most commonly used drugs in the country for people over 60. Vitamin B12 does 3 jobs your body cannot do without. It helps make your red blood cells, it protects the coating around your nerves, and it supports the brain chemistry behind memory and focus. When B12 runs low, none of those jobs get done properly, and the warning signs are so slow and so vague that most people mistake them for ordinary aging. What I am is someone who's spent a lot of time digging through how common medications interact with nutrient absorption in older adults, because it's a topic that rarely comes up in a rushed appointment. Today, we're counting down 7 medications that are known to interfere with B12, from the one that causes the mildest effect to the one that causes the most. Quick question before we start: are you currently taking any medication for acid reflux or heartburn? Drop a yes or no in the comments. It matters more than you think, and we'll get to why. Let's count backward, because the most surprising one comes first. 7. Metformin. If you manage type 2 diabetes, there's a good chance metformin is part of your daily routine. It's effective, it's been used for decades, and for most people, it works well. But here's what a lot of people never hear from their pharmacist: long-term metformin use is associated with lower B12 levels over time. It doesn't happen overnight. It tends to build gradually over months or years of steady use. The tricky part is that the early symptoms of low B12, some fatigue, a little brain fog, look almost identical to symptoms people already associate with diabetes itself. So, the deficiency can hide in plain sight, mistaken for just part of managing the condition. This isn't a reason to stop metformin on your own. It's genuinely one of the most effective medications for blood sugar control available. It's a reason to ask your doctor whether it's time to check your B12 levels with a simple blood test, especially if you've been on it for several years. A lot of people who take metformin long-term benefit from a B12 supplement alongside it, but that's a conversation to have with your doctor, not a decision to make solo. 6. Long-term antibiotics. Most antibiotic courses are short, a week, maybe 2, and they don't meaningfully affect your B12 stores. This one is about the exception: seniors who are on a low-dose antibiotic for months at a time, often for a recurring infection, or as a preventive measure. Extended antibiotic use can disrupt the balance of bacteria in your gut, and some of those gut bacteria actually play a small role in helping your body process B vitamins. It's a quieter effect than some of the others on this list, but over many months, it adds up. If you're on a long-term antibiotic prescription, this is simply something worth mentioning at your next check-in, not something to panic over. 5. Metformin's cousin: other diabetes medications combined with a restricted diet. This one is less about a single drug and more about a combination. If you're managing diabetes with medication and you've also cut back on animal products, less meat, less dairy, fewer eggs, for cholesterol or weight reasons, you've unknowingly stacked 2 B12 risks on top of each other. B12 occurs almost entirely in animal foods, so when a medication is already lowering your absorption, and your plate has less of the vitamin to begin with, the two effects compound each other. Neither habit is wrong on its own. They're both common, sensible choices people make for good reasons. It's the combination that quietly increases the risk. If this sounds like your situation, it's worth simply saying so out loud at your next appointment: I'm on this medication, and I've also cut back on these foods. That one sentence gives your doctor the full picture instead of half of it. 4. Proton pump inhibitors, the heartburn pills. Here's the one I asked about earlier. Medications like omeprazole and similar acid reducers are some of the most widely used drugs among people over 60. often taken daily for years for reflux or heartburn. Here's the mechanism in plain terms. Your stomach needs acid to release B12 from the food you eat, so your body can absorb it. Acid-reducing medications do exactly what they're designed to do. They lower stomach acid. The side effect is that less B12 gets released and absorbed, even from a healthy diet. The tricky part is that these medications are often taken for years without a second thought, because heartburn feels like a small, manageable problem compared to the disease it's treating for. But small and manageable over 1 year becomes different over 5 or 10 years. If you've been on an acid reducer for a long stretch of time, ask your doctor two things: whether you still need to be on it at the same dose, and whether it's worth checking your B12 levels. Sometimes the dose can be lowered once the original problem is under control, but that's a decision for your doctor, not something to adjust yourself. 3. Metoprolol and certain other blood pressure medications. This one surprises people because blood pressure medication feels completely unrelated to a vitamin found in food. The connection here is less direct than the others. Some blood pressure medications are associated with subtle changes in appetite or digestion in a portion of people who take them, which can indirectly reduce how much B12-rich food they're eating day to day, rather than blocking absorption directly. It's a smaller, indirect effect compared to something like an acid reducer. But it's worth knowing about, especially if you've noticed your appetite has changed since starting a new blood pressure medication. That's worth mentioning at your next visit, not just accepting as part of getting older. 2. Nitrous oxide, even from a single dental or medical procedure. This is the one almost nobody thinks about because it isn't a daily pill. It's the laughing gas used for sedation during some dental work or minor procedures. Nitrous oxide can inactivate the active form of B12 in your body, and in someone whose B12 stores were already running low, which is common in older adults for all the reasons we've just covered. Even a single exposure during a dental visit can be enough to tip a borderline deficiency into a noticeable one. It's rare, but it's well documented enough that it's worth knowing, especially if you already know your B12 tends to run low. If you have an upcoming procedure that involves sedation, and you know your B12 has been an issue before, it's a reasonable thing to mention to whoever's doing your pre-procedure checklist. 1. Stopping a supplement cold turkey after starting one of these medications. And here's the mistake that ties every single one of these together: hiding in plain sight. Someone starts one of these medications, metformin, an acid reducer, whatever it may be, and at the same time, for completely unrelated reasons, they also stop taking a multivitamin or B12 supplement they used to take. Maybe it felt unnecessary. Maybe it was one pill too many in an already crowded pill box. Maybe nobody ever explained why it mattered in the first place. On their own, either change might have been fine. It's the combination, a medication quietly reducing absorption. At the exact same time, the one thing that was topping up your levels disappears. That creates the real problem. And because both changes happen separately, for separate reasons, most people never connect the dots. This is exactly why the earlier symptoms matter so much. The tiredness that doesn't go away with rest. The pins and needles feeling in your hands or feet. The word-finding trouble that feels different from normal aging. None of these are things to self-diagnose. They're simply signals worth bringing to a real conversation with your doctor, along with a full list of what you're taking and what you've recently stopped taking. Bonus tips. Now that you know the mistakes, here are 3 simple things worth knowing. Bonus tip 1. The blood test is simple. A B12 level check is a standard blood draw, often done alongside routine blood work you may already be getting. It's not an unusual or invasive request to make. Bonus tip 2. Food sources still count. Eggs, dairy, fish, and fortified cereals are all solid sources of B12. If a medication is reducing how much you absorb, eating B12-rich foods more consistently throughout the week, rather than occasionally, gives your body more to work with. Bonus tip 3. Timing can help with some medications. For certain acid-reducing medications, taking them at the lowest effective dose, and only for as long as needed, is something worth revisiting with your doctor, periodically, rather than assuming the original dose is permanent. None of these tips replace medical advice. They're simply things worth bringing up so the conversation with your doctor is more informed. Here's the bottom line. None of these 7 things are reasons to stop a medication your doctor prescribed for good reason. They're small blind spots, the kind that are easy to miss at a rushed appointment, and easy to fix once you know to ask about them. You're not managing this alone, and you don't need to become an expert overnight. You just need one piece of information you didn't have 5 minutes ago, that it's worth asking your doctor at your next visit. Given what I'm taking, should we check my B12? Which of these 7 surprised you the most? Tell me in the comments. I read every one. And if you're planning to bring this up at your next appointment, type asking below so I know this reached the people who needed it. Take care of yourself and take care of the small things that quietly add up.